Welcome, everybody. We're going to cover the entire history of endocrinology in an hour and 15 minutes. We're all ready here for that. What we'd like to do today is to give you a few fascinomas. I haven't heard that term in a while, the old medical school term of a few good cases, and also a kind of a quick review of some of the wonders of hormones. And the fountain of youth is a little bit of our topic today. And as you may know, the fastest way into your patients is via hormones. The fastest way to get results is via hormones. If we're working on energy metabolism and mitochondrial and DNA youthification, the fastest way to get there is via hormones, in my experience. How many of y'all are presently doing bioidentical hormone replacement? So about half, would we say? So we can. So some of this will be a little repetitive for you guys that have been doing this for 30 years, 35 years, like I have. I started with progesterone in 1975 with Ray Peat, PhD out of Oregon, and he was a student of Katrina Dalton, the English gynecologist, who in the 60s wrote some of the first studies and treatises on natural bioidentical progesterone. And what's the difference between progesterone and medroxyprogesterone acetate? Anybody know? Raise your hands. What's the difference? Two people? Oh, my heavenly days. I'm glad you came. Provera was that nasty stuff that was Prempro. And Provera is that awful stuff that was used in the Women's Health Initiative, the 5.5-year study of 20-some thousand ladies that was canceled in 2002 because of the obvious increased risk of stroke, heart attacks, breast cancer, and blood clots. And when this was broken down, they found that this absolutely was a problem with Provera, the Premarin, and even all those never researched equine estrogens wasn't even the problem. It was the Provera, which looks more like testosterone than progesterone. So it's medroxyprogesterone acetate, and we'll cover that here in a minute. But that's worth the price of admission. How come gynecologists don't like progesterone? Anybody have any clues? They can't measure it. If you do bioidentical topical progesterone, it doesn't ride around in the serum. So if you draw a serum progesterone and you're taking it topically, it doesn't show up. It rides around on red blood cells. So this is kind of a melange today. But if you're going to measure progesterone, you have to do it via saliva or finger stick red blood cells. And most people prefer to do saliva testing of all these hormones because it does show tissue levels and free hormone levels. And of course, as we age, we all increase that nasty old buzzard sex hormone binding globulin, SHBG, which means that our hormones are not nearly as available and bioavailable. So anyhow, we'll be circling around some of these things, but if nothing else, we hope to touch on progesterone, and later on today, Dr. Taylor will also be into talking about female hormones. So I'll kind of zip through female hormones a little bit. And if you haven't really looked at being out of the box on thyroid, we'll get to that pretty quickly. So do I just do up and down here, I bet?
Yeah.
Yeah.
There you go.
So all the thyroid hormones, the adrenal cortical hormones, progesterone, the estrogens, testosterone, DHEA, pregnenolone, human growth hormone, and melatonin. I thought we were passing out these slides that you'd have at your syllabus, but apparently you don't. So I have 180 slides, just imagine they're in here. And I think you probably would be able to get some of this on the CD. And towards the end, there's a lot of good studies. I've included a lot of nice studies, especially of testosterone and DHEA and pregnenolone, in regards to their anti-inflammatory power, and some nice Stanford studies, also their importance in depression in adults and children, And good old testosterone, which is so wonderful and covers so many aspects of male and female hormone needs, that I hope that you guys read up on testosterone, especially Dr. Eugene Shippen's wonderful book, The Testosterone Syndrome. So as we know, about age 40, all of our hormones start going south, and it's very worthwhile to put them back. In many people, kids have low hormones, babies have low hormones, adolescents have low hormones. So it's not just the aging process that causes hormonal deficiencies. And if you're not looking for them, you won't see it. And our environment is so funky with xenobiotics, things that look like estrogens, plastics, volatile organic hydrocarbons, many drugs. These all mimic the functioning of hormones, especially many of the soy products. If you're feeding isomil to your baby, it's like giving a couple of birth control pills worth of estrogen to the poor kid. And that's why everybody's starting to look more unisex. So if you want to make your boys into little girls, feed them isomil. Actually, we go for whey-based proteins in the formulas. Leaky gut, life stresses. Everybody that I see, I would say 96% of the people that I see, their adrenals are compromised. And again, we'll talk about this. I do want to acknowledge Jim Paoletti of ZRT for some of these slides, as well as Kenna Stevenson, MD, the University of Texas, who really writes a lot on women's health issues, as well as James Wilson, another old Kansas buddy, who wrote on the adrenal fatigue syndrome and a lot of new interesting ways of dealing with adrenal.